Medicare and its many options can be difficult to understand. You may be thinking, what are my options? How do I decide which parts are right for me? What is covered under each part? Which parts do I need to pay for? But with these options comes the chance to create a customized Medicare solution for your unique needs. Let's examine Medicare more closely and determine what's right for you. This is George. He just turned 65 and needs help understanding which parts he needs to remain covered. By walking through the Medicare alphabet, we'll help you and George figure out how Medicare can work for you. First of all, what exactly is Medicare? Medicare is a federal health insurance program for U.S. citizens or lawful residents of the United States. To qualify, you must be 65 or older. You may qualify if you are under 65 if you have certain medical disabilities. Medicare is made up of 4 parts: Part A, Part B, Part C, and, you guessed it, Part D. There is also Medicare Supplemental Insurance, but we'll get into that later. Parts A and B make up what is known as Original Medicare. Part A typically goes into effect automatically when you turn 65 and is free to most. Parts B, C, and D are optional and are plans you need to pay for. Part A is commonly known as hospital insurance. It covers inpatient hospital stays, skilled nursing care, hospice, and limited home health care. In order to qualify for Part A, you or your spouse must have worked a minimum of 10 years and paid at least 40 quarters of Medicare taxes. If you've met these requirements, there is no monthly premium. However, you will still have to pay for hospital deductibles and copays. George just turned 65 and has worked in the U.S. for the past 40 years. He is automatically enrolled in Part A and doesn't have to pay for the coverage that comes with it. Part B, on the other hand, is medical insurance. It covers doctor visits, outpatient procedures, diagnostic tests, medical supplies, vaccines, and preventative care, such as mammograms, diabetes, and prostate screenings. Unlike Part A, you must enroll in Part B. Most people have to sign up for Part B insurance, and the monthly premium is based on your income level. To make paying for Part B easier, you can choose to have the premium deducted from your Social Security. Since George likes to stay on top of his health, he will likely sign up for Part B. This way, he can see his doctor for yearly visits, have his cholesterol checked, and receive his flu shot. Based on his income level, George will pay a monthly premium. To make it easy, he could elect to have the premium taken out of his Social Security check. Smart thinking, George. Even with Parts A and B, there are still gaps that need to be filled. One option is to purchase a Medicare Supplemental Insurance policy. Medicare Supplement Insurance, also known as Medigap, is meant to supplement Parts A and B. It helps to cover costs not covered by Parts A and B, such as deductibles, copays, and coinsurance. Plus, you have the added benefit of being able to choose any doctor or healthcare provider that accepts Medicare. Medigap plans do not cover vision, hearing, dental, long-term care, or prescription drugs. It's also important to note that with Medigap plans, you still pay a premium for Part B and your Medigap plan. As mentioned, Original Medicare and Medigap don't cover prescription drugs. That's where Medicare Part D comes in. Part D is offered by insurance companies to cover prescriptions. Each Part D plan has a list of generic and brand name drugs that are assigned to that plan, called a formulary. Each drug is assigned to a tier, which determines how much you will pay for that drug. You can get Part D as a standalone plan or as part of a Medicare Advantage plan. So, how do you enroll in Part D? You can sign up when you first become eligible for Medicare. It is optional, but know that prescription drugs are not covered under Parts A or B or Medigap. With his high cholesterol, George takes a prescription drug. To avoid having to pay the full price of the medication, he could sign up for Part D coverage and pay a copay each time his prescription is filled. Another option for you could be a Medicare Advantage plan, also known as Part C. Part C acts as primary insurance in the place of Original Medicare. It covers hospital costs, doctor's visits, and other medical services covered by Original Medicare. Plus, Medicare Advantage plans can include worldwide emergency and urgent care, prescription drug coverage, routine vision, hearing, and dental, and even gym memberships. To qualify for Medicare Advantage, you must already be enrolled in Parts A and B. You will still need to pay for Medicare Part B on top of your monthly Medicare Advantage premium. Finally, you must permanently reside in the plan's service area. At this point, you and George may be asking yourself how to decide between a Medigap or Medicare Advantage policy. Let's take a closer look at the major differences. First, with Medigap plans, you can select any doctor or hospital as long as they accept Medicare. You can see a specialist without needing a referral from a doctor. There are no network restrictions, so your coverage goes with you throughout the United States. The best time to buy a Medigap policy is during open enrollment, the 6-month period that starts the first day of the month you are turning 65 and you are enrolled in Medicare Part B. During open enrollment, you cannot be turned down. You pay a monthly premium in addition to Part B. When you use services, your out-of-pocket expenses are limited. Prescription drugs are not covered, so you should consider whether Part D is right for you. Now, let's talk about Medicare Advantage plans. Unlike Medigap plans, you may be required to use doctors and hospitals in the plan network. You may need referrals and may be required to use network specialists. You may have network restrictions. However, emergency care is covered for travel within the United States and sometimes abroad. Generally, you can only enroll or switch Advantage plans during specific times of the year. Many times you pay a low or $0 monthly premium in addition to Part B. When you use services, you pay copays, coinsurance, and deductibles. Finally, most Advantage plans cover prescription drugs. With the help of an insurance specialist, you and George can decide which supplemental insurance plan fits your needs. Phew! That's a lot of ground to cover. Hopefully, you have a better understanding of the Medicare alphabet and how it works. With the assistance of your personal Saleme insurance specialists, you are now on the right path to choose a Medicare plan that works for you.